Hi there, welcome to today's video where we will explore a topic that's close to many hearts, spinal muscular atrophy or SMA for short, and how physiotherapy plays a huge role in managing the condition. If you have ever wondered how movements can change the lives of those living with SMA, stay tuned. Now, if you are not familiar with SMA, it is a rare genetic disease that affects the motor neurons of the spinal cord, leading to muscle weakness and over time loss of movement. It sounds pretty serious, and it is, but the good news is physiotherapy can make a real difference. Now think of a motor neuron as a communication highway between your brain and muscles. In SMA, these highways get damaged, making it harder for the muscles to get the signals they need. Well, before going into the physiotherapy aspects, let's see how spinal muscular atrophy affects the body. It leads to muscle weakness around hips and thighs, difficulty in breathing, lack of muscle tone, diminished reflexes or slowing of reflexes, spinal curvature that is scoliotic, difficulty swallowing, and muscle weakness of back and shoulder muscles. Now, coming on to the physiotherapy aspect, well, physiotherapy in SMA isn't just about exercises. It's a comprehensive approach aimed at preserving strength, improving mobility, and ultimately enhancing quality of life. So first, maintaining the strength. While physiotherapy can't cure SMA, it can certainly help keep muscles strong for as long as possible. We focus on targeted strengthening exercises, but we don't want to push too hard. The goal isn't overexert the muscles, but to keep them active, especially the ones that are still functioning. Move on to the prevention of contractures. If muscles becomes too weak and aren't moving enough, joints can stiffen and become deformed, which can really limit the movement. That's where passive stretching comes in. And gently stretching the muscles and joints, we can help keep things flexible and prevent those painful contractures. Now, improving mobility is another huge goal. SMA often leads to difficulty walking, standing, or even sitting. But with the right physiotherapy techniques like using assistive devices, gait training, and posture management, we can help individuals maintain or regain some independence. Sometimes it's as simple as using a walker or a wheelchair. Other times, it involves strengthening exercises or training on how to move in different ways. Improving mobility is another huge goal. SMA often leads to difficulty walking, standing, and even sitting. But with the right physiotherapy techniques like using assistive devices, gait training, and posture management, we can help individuals maintain or regain some independence. Sometimes it's as simple as using a walker or a wheelchair. Other times it involves strengthening exercises or training on how to move in different ways to make daily activities easier. Now here's something important you might know, which is the respiratory muscle weakness. Yes, SMA can also affect respiratory muscles, making breathing harder over time. That's why we also incorporate breathing exercises and techniques like postural drainage to help improve lung functions and reduce the risk of infections. And it's not just about exercises, it's also about positioning. Correct posture can reduce the stress and even prevent issues like scoliosis. So key physiotherapy interventions include strengthening exercises, targeting the unaffected muscles, and avoiding the overexertion to prevent an injury. Range of motion exercises, passive or active range of motion to prevent joint stiffness and contractures. Management, correcting the positioning to reduce musculoskeletal strain and improve breathing. Then we can use assistive devices, which are orthotics, which may be wheelchairs, and standing frames to aid mobility and breathing exercise. Now moving on to the physiotherapy aspect of different types of SMA. Let's talk about the different types of SMA and how physiotherapy can be adapted for each. SMA type 1 is the most severe form, usually diagnosed in infants. For these little ones, physiotherapy focuses on gentle exercises, then positioning and breathing techniques to prevent respiratory complications. Even though the condition is very tough and challenging, physiotherapy helps to improve comfort and mobility and can provide relief. Now moving on to the SMA type 2, which typically shows up in toddlers and children. Here we focus on strengthening exercises, ROM training, and mobility aids like wheelchairs or standing frames. And the third is the SMA type 3, where the disease usually starts later in childhood or adolescence. Physiotherapy really focuses on maintaining walking ability and preventing muscle atrophy with exercises that boost endurance and strength. So at the end of the day, physiotherapy is all about empowering movement, whether it's improving strength, preventing deformity or joint contractures, or and helping someone breathe better along with the enhanced mobility. So respiratory physiotherapy includes breathing exercises such as deep diaphragmatic breathing and deep inhalation, postural drainage techniques, and assisted coughing techniques. Positioning and posture management. Correct positioning help maintain muscle length, reduce pressure ulcers, and optimize respiratory functions. We can also use supportive devices like cushions, adaptive chairs, and wedges to maintain proper posture and prevent scoliosis. Now, there are also emerging therapies and future directions like gene therapy and integration of physiotherapy with other aspects to manage long-term care. Thank you for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more content on health and wellness. Have any questions about SMA or physiotherapy? Drop them in the comments below. I would love to hear from you. Until next time, stay active, stay healthy.